How are Florida's different home care providers regulated? We get the call often at Superb Care Inc., home care consultant in the state of Florida, with a little bit of confusion how they are regulated. So I'm going to break down the difference of different types of providers and the type of regulation and the services that can be legally provided by each license type. So we're going to start with the home health agency in the state of Florida. There are two types. You have the state license only home healthcare agency, and then you have the state license and Medicare or Medicaid certified home healthcare agency. The services that can be legally provided by a state licensed only home healthcare agency is homemaker and companion, home health aid services, certified nursing assistant, and keep in mind that some home healthcare agencies only provide the above services. Then, in addition, you can do nursing services, LPN, RN, and therapy services, physical, speech, and occupational. If you would like, you can extend the services out to provide home medical equipment, social work services, and nutrition services. Then you have your state licensed and Medicare certified home healthcare agency. The services that can legally be provided by a Medicaid licensed, certified, and Medicare and Medicaid certified home healthcare agency are homemaker and companion, home health aid services, CNA services, nursing services, therapy, home medical equipment, social work, and nutrition, same as before. So the only differences between the state license only and the Medicare and Medicaid certified home healthcare agency is that you have to go through a different additional step in obtaining your Medicare certification. The next type of provider is a nurse registry. The nurse registry can legally provide homemaker and companion services, home health aid services, certified nursing assistant services, and nursing services. Keep in mind that some nurse registries do not provide nurses. Even though the term is nurse registry, you are perfectly able to run and operate a nurse registry by only providing CNAs and home health aid to provide those services. Now, if you decide to branch off to do the supplemental staffing component and provide nursing staffing, then of course you would need to provide nurses. Your next licensed type of provider is your homemaker and companion organization. With that being said, homemaker and companion can only provide homemaker and companion and respite type services. You cannot provide any services that require personal care. Personal care will be defined as physical touch to the client, meaning that you cannot bathe, clothe, or feed the client. Meaning, do not your hands cannot be put on the client. You're only there to help them with light housekeeping and different types of companion services to doctor's appointments and things of that nature. That is a homemaker and companion organization. Then you have your independent caregiver. That could be a certified nurse, that could be a nursing CNA, that can be an HHA. This is a licensed health professional that may provide services within the scope of his or her professional license. A home health aide or a certified nursing assistant may provide hands-on personal care, meaning that you can provide homemaker and companion services. So, can this provider type offer hands-on personal care to patients? We kind of talked about it, but I'm going to go over it again. The home health care agency, the answer is yes. For the state licensed and the certified Medicare and Medicaid home health care agency, yes. By home health aides and certified nursing assistants, you can provide personal care to the patients. For a nurse registry, yes. By a home health aide and a certified nursing assistant, you can provide personal care. But here is the area that a lot of people are confused about. With a homemaker and companion license, no, you cannot provide personal care services. Homemakers and companions cannot provide hands-on personal care if you're planning on getting a homemaker and companion license. But as an individual caregiver, yes, you can provide personal care to your patients, but only home health aides and certified nursing assistants will be allowed to provide those services under the scope of their license. Now, be it that you are 100% responsible if you are providing those services privately and not going through the agencies that carry those licenses. So now the next type of question is a background screening of personnel provided in-home services required? Yes, across the board, if you plan on getting a home healthcare license, a nurse registry license, or a homemaker and companion license in the state of Florida, yourself as the owner and your personnel are required to obtain a background screening, a level 2 background screening in the state of Florida. As an independent caregiver, it is solely up to the family who are hiring these private caregivers if they would like for them to get a background. But the answer is no, it's not required because you're not operating under a state license. Is a background screening of the administrator and chief financial officer required? The answer is yes for all three license types. The answer is no for an independent caregiver because, once again, that is a private caregiver who is providing services directly to a family and not under the state regulated license. Are there minimum standards for patient services? The answer is yes for homemaker and companion, for home health, nurse registry, and homemaker companion. I'm sorry, for home health and nurse registry, the answer is no for homemaker and companion organizations and independent. Meaning minimum standards means are there any other types of trainings that you have to provide in order to provide those services? Are there training and competency tests required for non-licensed personnel? The answer is yes for homemaker companion and nurse registry. I'm sorry, I keep saying homemaker companion. Home health agency and nurse registry, and no for homemaker companion and independent caregivers. Are there minimum requirements for any other types of things that you would need, like your licensing and things of that nature? The answer is yes for nurse registry, homemaker, and home health. Now, as you can see, there are different levels to the licensing in the state of Florida, with the home health being the most complex home care license. Nurse registry follows behind, and then you have your beginner license, which is the homemaker and companion, and the independent caregiver that provides under the scope of their license type in the state of Florida. Now, is insurance coverage required to operate a home healthcare agency? Yes. Liability and malpractice insurance is required up to $250,000 per claim. I always tell my clients to get a $1 million, $3 million liability insurance policy, just so in case you have multiple claims, then you have enough to cover your liability insurance. Same for your state licensed Medicare and Medicaid certified. With the nurse registry, no, nurse registries only have independent contractors, so the nurse registry agency themselves do not have to provide insurance, but I always insist that my nurse registries still get coverage just in case their independent contractors policies, individual policies have lapsed, and maybe you can file that claim under that insurance. Homemaking companions are not required to have insurance coverage, and independent caregivers are not required to have insurance coverage. So as you can see, the homemaker companion and the independent caregivers are a little bit more open to more malpractice without having any insurance coverage. But that is totally up to the family on what direction they would like to go in and get to receive care. Now, how are these services obtained? With the state licensed home healthcare agencies and the Medicare certified home healthcare agencies, the patient contracts with the home healthcare agency for services. The home health agency provides services through its own employees and contracted personnel directly to the client. With the nurse registry license, the patient contacts the nurse registry for the referral of an independent contractor to then be assigned, and they will provide the services. Meaning, which is the difference between home health and nurse registry of contractors versus employees. With a homemaker and companion organization, the client contracts with the homemaker and companion organization for services. The homemaker and companion organization provides services through employees and contracted personnel. So they can have a mixture. As for with the independent caregiver, the patient or the family contacts and contracts and makes individual arrangements with that worker. What are the primary funding sources for the different types of license types? For a home health agency, private insurance and personal funds are available. You do have some Medicaid waivers that are available in the state of Florida. Now, if you are going to get a state license and Medicare certified home healthcare agency, then you will have to go through the Medicare, Medicaid, private insurance process to become a provider to receive those different types of funding sources. With the nurse registry, your primary funding source is definitely private pay, personal insurance, and limited Medicaid waivers that are available for the nurse registry. For the nurse registry, you cannot take Medicare. I have to repeat this a lot because I get a lot of people who call and they're told that they can do Medicare with the nurse registry, and you can only do Medicare with the home health care agency. The type of funding source for a homemaker and companion organization will always be private insurance and personal funds. Same as with an independent caregiver, private insurance and personal funds from the families. Is nursing supervision required for home health care agencies? No. Supervisory visits are made only with the patient's approval and payment. So if the individual wants to receive private nursing services, then that is something that they will arrange with the home health care agency. But when you are doing a Medicare and Medicaid certified home health care agency, supervisory visits by an RN are required. The RN must visit at least every 2 weeks if the patient is receiving skilled care. If the care is limited to home health aid and certified nursing. So now you can see the differences between what we call the non-skilled home health care agency and the skilled home health care agency in the state of Florida. Are nursing supervision required for a nurse registry? The answer is no. But if a home health aide or a certified nursing assistant referred, the nurse registry must advise that an RN is available by request. Supervisory visits for nurses for a homemaker companion is a no because it is non-skilled. And of course, independent caregivers would be no as well. Is the director of a nursing or a supervising nurse required? For a non-skilled state licensed home health care agency, yes, if professional nursing services are being provided, but no, if the agency only provides non-skilled services, as in home health, certified nursing assistants, homemaker companion, or just therapy and physical, occupational, and speech. If you are providing skilled nursing under your Medicare, then yes, the director of nursing or supervising nurse is required. A nurse is not required for the nurse registry and not required for homemaker companion and independent caregiver. Are the general quality assurance requirements? The answer is yes for non-skilled home health care agency, but only for the agencies that require to have a director of nursing. And yes, across the board for a Medicare certified home health care agency. No for nurse registry, no for homemaker and companion, and no for independent caregiver for general quality assurance requirements. Is a nurse on call during hours of patient services? For a non-skilled state licensed home health care agency, yes, if nursing services are provided, a director of nursing and a 24-hour on-call nurse are required. Also, yes, for a Medicare certified skilled home health care agency. The answer is no for nurse registry, homemaker and companion, and independent caregivers for on-call nurse services. Are there unannounced on-site inspections? For the non-skilled state licensed home health care agency, yes, at least once every 3 years. For the Medicare certified, yes, once every 3 years. For the nurse registry, yes, you will have unannounced on-site inspections. Yes, at least every 2 years. Now, your first inspection is scheduled, what we call in the survey for you to get your license is a scheduled survey. But every 2 years after that, it could possibly be unannounced. You do not receive any on-site inspections for homemaker and companion license, nor is unlicensed independent caregiver receiving any inspections. Are providers required to notify patients and clients and how to report complaints and including dissatisfaction with the service? With a state licensed home health care agency, yes, on or before the first day of services, the agency must inform the client and his or her immediate family or representative of the right to complaints to ACA, how to report abuse, neglect, and exploitation, and the number is provided, and how to report Medicaid fraud, which the number will be provided in those documents, most likely in your policies and procedures and your sign-up packets to give them directions on how to report complaints. So it's also yes for a Medicare certified home health care agency. The requirements are the same as for the state license, only home health care agency. Yes, the requirements are the same for the state license for home health care agencies as they are for the nurse registry. Same as for the homemaker and companion for complaints, but no for the individual private caregiver because they are not regulated by the state. That would be more so criminal matter or civil matter that would be taken upon the family and the private caregiver because they went and hired a non-licensed, non-regulated independent caregiver. Are these state investigations? Are there state investigations of complaints? The answer is yes. If there's any complaints of abuse or theft, yes, the state will investigate those complaints for the nurse registry, for the home health care agency, also for homemaker and companion, but there are very few specific requirements for homemaker companion. Yes, an independent caregiver can be investigated by the state, but this would be likely be limited to the unauthorized practice of healthcare provision. Is the health statement for each person providing in-home services required? Yes, and health statement is required for anybody working under home healthcare agencies, anybody contracted under nurse registry, but no for homemaker companion and independent caregivers. Is an office required to be open and staffed a minimum number of hours per day for a home health care agency? Yes. 8 hours a day, Monday through Friday, except at legal and religious holidays. Same for the Medicare certified home health care agency. Yes, for the nurse registry, same 8 hours a day, Monday through Friday. So when you're opening up your administrative office spaces, keep in mind that you have to have an administrative staff there 5 days a week, a minimum of 8 hours for if anybody from the state or anybody that needs to come and have any questions about your services. You do not have to have an office space or required staff for a homemaker and companion, and independent contractor does not have to have an office space as well. Those businesses are normally ran from home or independent contractor businesses in the state of Florida for homemaker companion and private caregivers. Are penalties enforced for non-compliance with the laws and regulations? For home healthcare agency, yes, fines can be imposed by classes based on impact to the patients. There can also be a moratoriums and admissions and the revocation or denial of your license for your home healthcare agency. For the nurse registry, yes, fines can be imposed by the impact on patients as well, and the same they can put a moratorium on admissions and revocation of your license. Same as with the homemaker companion. So as you can see the pattern, if you are licensed by the state of Florida under ACA, Agency for Home Health Care Administration, if you have any penalties, they can be enforced. If you are unlicensed, it is not applicable to independent caregiver that is providing private insurance. Is staff training required on Alzheimer's disease and other disorders related to dementia? For a home healthcare agency, the answer is yes. For a nurse registry and homemaker companion and independent caregiver, the answer is no. Are there required agreements on the patients on the services that will be delivered and the payment amount? The answer is yes for the state licensed home healthcare agency. Yes, for the Medicare certified home healthcare agency, the patient has the right to participate in the planning of his or her care, to receive a copy of the plan of care, and to be informed prior to stating services if Medicare or Medicaid will pay for the services. Yes, for nurse registry, that they will get agreements on with the patients, and no for the home healthcare and independent services. Is the licensing or regulation fee required? There will always be a fee if you're submitting to ACA to get your license. The fee for home healthcare agency is required at the time of this video is $1,705 for 2 years. And for a nurse registry, it is $2,000 for 2 years. And for a homemaker and companion agency, it is $50.75 for 2 years. And of course, it does not apply to an individual caregiver because they do not have to apply for a state license. Are emergency management provisions required for events like hurricanes? And you know that we're in the state of Florida, so yes, there will be hurricanes. So of course, you will need emergency provisions normally outlined in your certified emergency management plans. So you would need to have those regulated and designed for your agency, for if you're planning on running a home healthcare agency, like state license or Medicare, a nurse registry. But no, you do not need emergency management plans for homemaker, companion, and independent care. So we have covered how the Florida regulates different home care providers. Of course, we start off with home health care agency, state license versus Medicare certified home health care agencies, the nurse registry, the homemaker and companion, and of course, an individual private caregiver. If you are in the business and you would like to start a new upgrade from a license that you have and branch off into different type of skilled home health care services, or if you're looking to start a nurse registry from scratch or homemaker companion, please reach out to us at Superb Care Inc. Home care staffing in the state of Florida. We only focus on the 67 counties in the state of Florida. So if you're interested in starting any of these home care services and getting a license, reach out to us at superbcareinchcs.com. You can submit contact this form, or you can call us directly to schedule a consultation. We definitely look forward to working with you, and good luck with your endeavors.